Sir William Foster once said, "The good physician treats the disease, the great physician treats the patient who has the disease." Good evening, ladies and gentlemen, distinguished guests, and esteemed viewers. I, Rina Ullas,
And Manaswini Rath.
as moderators, extend a very warm welcome to this engaging talk show, Power Hour Session 4, Episode 2. The field of medicine is much more than diagnosing illness or prescribing treatments. It's about caring for people, understanding their fears, offering hope, and making a positive difference in their lives. Behind every successful treatment is a doctor who listens, empathizes, and heals with compassion. Today, we are truly privileged to be in the company of two such inspiring doctors who has dedicated their lives to improving the health and well-being of others. Their journeys remind us that healthcare is not just a profession, it is a lifelong commitment to serving humanity. I'm sure this interaction will not only deepen our understanding of health and wellness, but also inspire us to appreciate the dedication, perseverance, and compassion that define the medical profession.
Thank you so much, Reena ma'am. That's so truly said. It's now my honor to introduce our first distinguished guest, Dr. Lopamudra Patra. Dr. Patra is a consultant obstetrician, gynecologist, and an advanced laparoscopic surgeon at SUM Ultimate Medicare Bhubaneswar. She holds an MBBS and an MS in obstetrics and gynecology and has devoted her career to caring for women through every stage of life, from adolescence and motherhood to menopause. She has extensive expertise in managing both routine and high risk pregnancies, performing advanced, minimally invasive laparoscopic surgeries, and treating a wide range of gynecological conditions, including PCOS, infertility, endometriosis, fibroids, ovarian cysts, menstrual disorders, and menopause related concerns. She also strongly advocates preventive healthcare, helping women make informed choices about their health and well being. What truly sets Dr. Patra apart is her compassionate approach towards every patient. She firmly believes that every woman deserves respectful, personalized, and evidence based healthcare built on trust, empathy, and clinical excellence. Her commitment to continuous learning ensures that her patients benefit from the latest advances in obstetrics, gynecology, and minimally invasive surgery. We are so much delighted to have you, Dr. Lopamudra, with us today. A very warm
Thank you
welcome.
so much.
Our second esteemed guest is Dr. Preeta Umi, a highly accomplished consultant, dermatologist, and cosmetologist at Forever Cosmoderma Skin Laser Clinic, Ottapalam, Kerala. Dr. Preeta completed her MBBS and MD in dermatology from the Government Medical College, Calicut. She also holds the prestigious DNB, MNA MS, and is American Board certified in aesthetic medicine. With vast experience in both clinical and aesthetic dermatology, she specializes in diagnosing and treating disorders related to skin, hair, and nails. Her expertise also extends to advanced cosmetic procedures such as laser treatments, dermatosurgery, injectables, chemical peels, skin rejuvenation, and anti-aging therapies. Known for her patient first approval, Dr. Preeta believes in delivering treatments that are not only effective but also safe, ethical, and natural looking. Her passion for continuous learning and her dedication to providing evidence based care have earned her the trust and admiration of countless patients. It's a privilege to have you with us today. We extend a heartfelt welcome to you, Preeta. My first question is to Dr. Preeta. Acne is a common dermatological condition experienced by many adolescents. Could you provide an overview of what acne is and how it forms?
Uh, thank you, Reena, and thank you, Delhi Public School, for giving me this opportunity. So, acne, as you know, it's a very common inflammatory skin conditions, and it's not seen in mainly seen in adolescent period, but recently we see in adulthood also. Normally, when we think about acne, we always think about face, but it's not that. It is face, upper trunk, arms, upper back, all the areas will be involved in this. This is basically a problem of the hair follicle and sebaceous glands. There are so many important factors to it. One is just the inflammation, the hormonal changes, genetics. So basically, what happens is that due to hormonal changes, there'll be increase in sebum production, and this sebum production will later lead on to the blockage of the sebaceous glands, and this will be there will be infection by the Propionibacterium acnes bacteria, and this will lead on to further inflammation. And you can initially see when the pores are just the skin pores are blocked. Basically, there'll be just the small what we call comedons, like in the low normal language we call it like blackheads, whiteheads, like that. Then gradually, with infection, it will progress to small pimples. Then finally, it may become cystic and large lesions. And this thing is, it may lead to scarring. So there are 4 points. One is blockage of sebaceous glands, followed by inflammation, hormonal changes, genetics, etc.
That makes total sense. For our viewers, noticing those early signs of acne, it is usually recommended to follow a skincare routine.
Once more question, it's not clear.
No, this is my response to the next question will be asked by Manaswami. Okay.
In fact, ma'am, thank you so much for that insight. I mean, yes, acne has been something which is truly a concern, I think, across all the ages, starting from the younger ones to we adults. Now, my question is to Dr. Lopamudra. Doctor, what contribution do you think school curriculum can make to educating teenagers and adolescents about sex in education in the current age of the internet?
Thank you so much, Delhi Public School, for giving me this platform to speak about this. Actually, today is the era of internet, and especially our children, adolescent, teenagers, all are exposed to internet and the content which is going on over there. So they are prematurely getting exposed to things about sex, about internet, about any random thing in the internet. So in the school curriculum, it actually, if we add sex education in the school curriculum, that will be much more age appropriate. Like in a gradation, the children can be introduced into puberty, into how the menstruation works, about the different body parts, about intercourse, about pregnancy, about contraception. So it will be all age appropriate. So with the higher, मतलब छोटे से लेके बड़े तक you can introduce accordingly the way the child can grasp. And of course, sex education in school will provide a safe platform for the children to come back and answer, uh, get a better answer for their questions. Internet can provide any random information, but for them to come back to school and to ask the teachers, especially the biology teacher, if they want, they can come and directly ask any question they have in their mind and get an appropriate answer for that. Yeah.
Thank you. I mean, certainly reframing this partnership between the teachers and the students and the school curriculum, if it comes in, as you clearly said, school is a very safe place where things can be openly discussed without being the feeling of judged. Thank you so much, Dr. Lopa, for sharing that.
Okay.
Over to you, Dr. Preeta. Hormonal imbalances, as you just mentioned few minutes back, can manifest in various ways, including the skin concerns. So could you shed some more light on how this hormonal acne comes in, its causes, symptoms, and what treatment options are available nowadays?
Definitely, Rano. Especially hormonal acne is more common. It's very common, in fact. Maybe because of the lifestyle, the food habits, the stress you're going through, all that can cause this hormonal acne. So this is basically this alterations hormone. The most common that we come across, as Dr. Lopamudra knows, is PCOS. Previously, we never used to come through. Now every second girl has PCOS. So that is basically, it has something to do with the lifestyle. So this increase in hormonal, that will cause naturally increase in sebum production. Even stress will cause increase in sebum production, junk food, all that. This will cause increase in hormones and blockage of sebum glands, and this will lead to acne. But basically, hormonal acne can be from the starting. We treat hormonal acne just like any other acne. To be start with mild, if it's mild or moderate kind, because we know all in 90% acne there is a hormonal basis, and especially in ladies after 30, hormonal acne is more. And what how do I identify? It's like usually in the adolescent period we see more over the cheeks, and as you go into 30s, even sometimes 40s, people come and ask me why I'm getting at this age. It is supposed to come during my teenage, but that is not the point. It can appear at any point. So hormonal acne will be just like any other acne. We start with mild topical treatment like tretinoin, benzoyl peroxide, topical antibiotics like that. If it is, that's very mild ones. Then we ask them to use a normal skin routine, follow skin routine. But if it's not getting, we go in the moderate area, we go for anti-acne antibiotics. Like along with the topical, we add on antibiotics as well. And the third option is something called isotretinoin. That is not basically an antibiotic. That will dry up the skin, dry up the sebaceous gland. So the basic problem is treated. And hormone treatment for acne is a last resort. Usually we don't go off all. Unless it is so well connected to PCOS and some metabolic syndromes, we don't give hormone treatment. And naturally, we'll send to a gynecologist for expert advice regarding the basic cause, because unless we treat the basic cause, acne is not going to respond. So that way we go for the hormone treatment. There are hormone treatments like along with, if the acne is not getting controlled with any of these things, then we have to add hormone treatment, sometimes OCPs to have regular periods, sometimes medicines like spironolactone, even metformin, which is actually a medication for diabetes, is sometimes added. So hormonal acne, there is no specific treatment, but to start with, every acne is treated like a normal thing. And as we go and we identify some hormonal cause or some metabolic syndromes, we deal with it. That is the protocol.
Thank you, Dr. Preeta. Really appreciate that explanation. It is so helpful to understand that acne is not just a surface issue. It can be something which is related to the body inside out. Really appreciate that explanation.
My next question is to Dr. Lopamudra. When should someone at an age of 13 to 18 have their very first gynecologist appointment? If a teenager in the age group of 16 to 18 who spends a considerable time within the school premises want to see a gynecologist, would you recommend meeting the child alone or with parents? And are your views regarding keeping the school in book?
So, on a very nice question. There is no certain age, like as if mentioned, that every girl has to visit a gynecologist. They can come according to the symptoms they are facing, like in early, at the onset of menarche. Many young girls face continuous bleeding, like the menses are not regular. Some come with continuous bleeding, some come with irregular bleeding. So in any of these symptoms, if they are facing of irregularity of the cycles or any severe pain abdomen, any crampy menstrual cycles, or any of smelly vaginal discharge, any gynec complaints, they come the minute they face any problem. And regarding in the late teenager, if the child wants to come and consult a gynecologist, of course, we would want that the child should be accompanied with a parent, because parents are the first and the foremost safest place of every child. The parents should be coming along with the children, and they can come and discuss the problems. Sometimes the late teenagers, they feel embarrassed to ask questions in front of the parents. Some internal questions like, maybe some unprotected intercourse exposure, something regarding contraception, regarding vaginal related any issues. So in that case, we tell the parent to just give a minute time so that we can have a talk in private. And later, if anything we found that the parent should be informed, we inform. And considering about the fact of taking the school into loop, yeah, actually, medical attention, medical meetings are usually confidential until and unless there is something chronic, something which the school management should be knowing, like the child has some chronic medical condition in a regular medication or something, some off thing which is noticed by the doctor happening in the school premises or something, then we can take the school into loop.
As a parent myself, I can well relate it. It's so important to highlight that this first visit is mostly a conversation to build trust, not a scary clinical process. Thank you, ma'am. My next question is to Dr. Preeta. A wide range of skincare products, including moisturizers, cleansers, and sunscreens, are marketed for acne prone skin. Is it advisable to use them? And how should one choose the right product?
Actually, definitely we should follow a skin routine. That's very important. At any age, skin routine is very important. Because in this time, there are children, especially the adolescent people, they just see the YouTube and buy whatever products they like. So that is leading to we come across a lot of cases in which they end up in trouble using. We should use all these products, but it should be correct for your skin type. That is more important. The three things must use, that are cleansing, moisturizer, and sunscreen. These things should be used. Sometimes parents ask me from what age. Usually 10 to when they become matured, that is, then they have their menarche. Post menarche, their skin is going to react and have going to show different changes. So from that onward, they can start using even sunscreen. Even children can use. And basically cleansing. First point is cleansing. Cleansing, we should not use harsh products. Depending on skin type, is dry skin, you should use the product that is suitable for sensitive skin or dry skin. If it's oily, we should little more products containing some glycolic acids and things like that to reduce the oiliness. So avoid using harsh ones. And contact period is also very important. Use very little quantity. That they will finish one face wash in 10 days. That is not the way to do it. They should use little bit with us and use it properly. Mild, preferably a mild one, not harsh one. So that is a cleaning the face at least 2 to 3 times a day is advisable. Coming to moisturizer, that also, if you have oily skin, you should use a water-based one, lightweight. And if you have a normal skin, it's okay. And that is the thing. In this time, no, what the peer group, the friends will use and they will also use. But the skin is different from person to person. What suits her may not suit you. So that way you have to be careful. So moisturizer, lightweight ones, water-based ones is perfect for oily skin. And for dry skin, they can use little more thick ones. The third is sunscreen. Sunscreen, there is people will say you need to apply sunscreen only on sunny days. It's not like that. Every time sun is there always. So from 8 o'clock to 3 or 5 o'clock, you should use it. And one thing is that you should use gel-based ones and a little water-based one for oily skin and little thicker ones for the cream-based for the dry skin. That is a correct protocol. And while using sunscreen, you have to reapply it every 4 hours. There is no sunscreen that will last for 24 hours. You will see in ads only. But when you use that, when you need that much of protection, you need to apply like cricketers, like white patches over the face. That's not possible for us, aesthetically not acceptable. So we should use sunscreen, reapply every 4 hours, and use a sunscreen that is suitable for your skin type. So these three things are a must. You should follow this skin routine. That is cleansers, moisturizer, and sunscreen. Even moisturizers can be used at night as well.
So, ma'am, would you suggest, because like how we come across some cosmetics and commercial products for intimate hygiene, so because it's connected, and both of our doctors, cosmetologists and gynecologists, are here. So would you suggest using such products for kids or maybe the early adults, this kind?
There's no harm in using I am that actually there are special creams for intimate areas. You should use a moisturizer at least because there will be like skin will be thick because especially when during weight gain and all that, no, there'll be friction, there will be pigmentation. You can use, but you should not use the strong ones. Like, and avoid steroid containing in the intimate area. That is most important because that's very common and available over the counter in our country. So one thing is that avoid steroids in intimate areas. You can moisturize the area, and there will be specific creams like containing lactic acid, all that that is suitable for intimate area. You can use them. There's no issue in that, provided it's safe for the area.
It's so empowering for our viewers to know that they should focus on active ingredients rather than fancy marketing prompts. Keeping it simple with a gentle cleanser, lightweight moisturizer, and SPF really seems like the safest baseline.
I agree, Reena ma'am. A very important question, and thank you so much, Dr. Preeta, for answering that. Dr. Lopamudra, moving on to you. We are hearing a lot about artificial intelligence, AI, which is all in the air, being used in imaging. It has made its place in hospitals and clinics. So, what do you think? How is AI currently helping you as doctors spot things like early stage ovarian or cervical cancers that maybe children should be aware of and our human eye might miss? So, would like to know how you are, or if at all, planning to use AI in your current stream of medicine.
Again, an interesting question. Yeah, this is again the era of internet, of AI. Yeah, we can use AI in certain diagnosing certain cancers, but it can always act like an assistant. Whatever AI says is not final. AI can help us in reading USG imaging reports or some MRI reports in assessing how the ovarian mass is looking like in the picture, maybe towards malignant side or more towards the benign side. But anyway, the final decision is all about how the clinical symptoms the patient has presented with, how, like, what was the duration of her symptoms, the radiological picture, the tumor markers, blood picture. Collectively, we come to a final diagnosis. So yeah, AI can be an assistant, but not a gynecologist, not a doctor. Even it can help in assessing cervical cancer, like the cancer screening tests we do. We do colposcopy, we do pap smear. In reading those slide images or reading those colposcopy images, AI can be a bit of help. But again, as I said, Googling something or putting something, some image in the AI, and then if it's showing you have cancer, and then many patients we encounter, they have already done all the research in Google, all the research in Chat GPT, come with a pounding heart, मेरे को cancer हो गया है. But
I
then
can
we
understand that. Yes.
clarify कि no, this is this, this is this. So आपको cancer नहीं हुआ है. It is just the vaginal infection which you are encountering. Any discharge मतलब cervical cancer हो गया. Any pain abdomen, ovarian cancer हो गया. So yeah, so we all tell our patients, I know you have Googled, especially the software people. They're too much into Google and AI. So they have already done their workup and they come to us with lot of questions in their mind and answers along with that. They know the question, they know the answer. But then what extra we do is to make them understand key looking into all these factors, we have the possibility it might be a benign tumor. Not always all the tumor is a cancerous tumor. So yeah, AI can just help as an assistant, but the final diagnosis is always given by a doctor. And I don't think in the long run AI is going to replace doctors.
I completely agree. I think they should not also replace doctors. I mean, then in that case, half of the IT people might become doctors, as you just mentioned. Gemini, Claude, and Chat GPT being there at their disposal, it can actually give them a lot of stress. And it's actually truly fascinating to realize that AI is acting like a replacement and is giving you that high-powered magnifying glass effect, wherein you can see things much more clearly. Thank you so much. Dr. Preeta, moving over to you. Many people struggle with acne, as we have been discussing, while others hardly experience it. So, what factors make certain people so much prone to acne, whereas others are blessed with that typical Korean glassy skin, as we see as a trend nowadays? So, is acne primarily a condition only related to the teenagers, or as you mentioned, it can be for any age? And what is the most common cause for adult acne?
Acne is not a teenage disease. It can happen in teenage and adulthood also, especially adult females after 50, after 30. So basically, there are so many factors. It's multifactorial, and the main factor is one is genetics. If the father and mother they have both have acne, there is a the child with a big high chance for the children to get the same. So when they have that history, they should be little careful. I tell them after 12, no, don't eat eggs, too much eggs and oil. It's not the diet alone, but still diet has a role. Diet with high glycemic index has a role. And another thing is that, like I told you, the present lifestyle. There is a change in food habits, so much of junk, deep fried, and all that stuff. That is another factor which is causing acne. And then hormone. It is all like a chain reaction. You will have junk food, more of junk food, no exercise, too much of TV and mobile, and then you will end up being little obese, and that will cause to hormonal. Then we'll go to PCOS like that. It's like a chain of events. And in adult acne, mainly after that is mainly hormonal. Another thing is that children who have teenage acne, later it may subside. And maybe after in their 30s, it will reappear. So hormonal acne, as I told you, after 30s, mostly it will be the lower side of face, only mandibular. And in the young, well, usually cheeks there'll be more prominent lesions.
Mostly the T region, is it? Because I remember as an adolescent, as
This
a college
very
goer,
oily. Like this is the
yes,
T zone. That's very oily. So it will be mainly cheeks and the forehead and all that. But as we age, it will become more like concentrated towards the lower half of the face. That's more like a hormone. So that's no stress is another factor. Even children have a lot of stress, you know.
after all,
And
ma'am, if they have to, I'm sure many of the aspiring doctors are watching you right now. So if
uh,
they have to come up to what Dr. Preeta is currently today, I'm sure they have to take a little
yeah,
bit of stress
they
and
have.
bear with that
And
hormonal acne.
basically, out of the subject, these days children are not ready to take any stress. They just want a easy thing, easy life. So that is there. And so this hormonal adult also, and that will this PCOS hormonal issues another thing that will lead to acne. So there are it's all these factors put in together, the diet, the genetics, and but some people by God's grace they have like you told, a Korean glass skin and lucky to have that. That is there. But we can always improve our diet and like to make it more healthier.
It's very true. I think I will agree to you, Dr. Preeta. I mean, normalizing adult acne is so important because people become so conscious and they feel, okay, my photographs don't turn out good, or this is my certain angle. I should avoid this, I should avoid that. But thank you so much for giving us that clarity that it is the internal genetics or the hormones which play a role, including the family history, as you just mentioned. And it completely shifts your perspective from self blame that maybe I'm not taking care, but maybe it is something else. It's my genes and the history which also might be speaking about.
Yeah,
Yeah,
if you ask some children to control food, no, they'll tell even without eating also I'm getting acne. So what is the point?
I think I would agree to that. Yeah.
Thank you, Preeta. Now we move to Lobomudra. Ma'am, we have already spoken about sex in education. Now, as a biology teacher, I always felt the responsibility of sharing the right things with my students in the class. How important do you think is the parents' role in talking to the children about their reproductive health to make informed decisions at different stages of life?
Absolutely. Truly feel the parents are the first line educators in the home. It's not about key whenever the child will come and ask some question, then you will educate or then you will answer. It should be a gradual process. Like starting with a young age, when the child is growing, when the especially the girl child is growing, it is important to talk about good touch, bad touch, even for boy child. What is a good touch? What is a bad touch? What is privacy? What is consent? Which areas our people should not touch? Matlab, how to allow somebody even to touch your intimate areas or not? And if something like this has been done, just to come back home and inform, that should start at an early age. And then in the middle age, when the body is changing, when the child is attending puberty, again to teach the child what is puberty, what is all these body changes which is happening, what is menstruation, how frequently female menstruates, and how to maintain that menstrual hygiene. It is equally important for a boy child to understand menstruation, because initial days when we were having our puberty, we were very scared if a boy notices that I am menstruating, what he will say in school. It is a common experience which all the girl has. But in this era, I feel all the moms are educating their boy babies about menstruation at the age of puberty, so that they will be very much empathetic towards their classmates who are girls. They won't bully, they won't tell ki, Are, look, what kind of a stain she's having, all that. That will make a comfortable environment for the girl also who is menstruating. And when they are entering their late teenager, then they should talk about what is intimacy, what is attraction, if you're getting attracted, what are the boundaries, what are your like responsible choices you should make, about teenage pregnancy they should be telling. So, and about contraception, about sexually transmitted diseases, there are many more things. So this discussion at home should be gradual. We should be listeners, we should have that environment at home कि the child should come home and speak about कि आज like something I have noticed at school, is it okay, is it to do this, like is it doing this is right or this is wrong? So we should be listeners, not lecturers. If the child knows, if I talk about this at home, mama or dada will blast me. No, it should be some environment like this that the child
Parents
can
should be
openly
very
come
open
and,
to the
yeah, open to the
kids.
pet. Then only we can have a insight of what is going on in their life, and we can help them a bit in that way. Yeah.
So the takeaway is very clear. Sex education shouldn't be a hidden topic at school. When parents step up as open, approachable resources at home, teenagers are far better equipped to make safe, informed choices for life. Thank you, ma'am. Thank you for that valuable insight.
Well,
Let us move to Dr. Preeta. Hormonal therapy and oral therapy are often recommended for treating acne. How effective are these treatments and who are the right candidates for them? Could you also explain how these treatments work, their potential side effects, and whether they offer a long-term solutions for acne?
Actually, as I told earlier, when we say patient is their acne, we basically grade them, whether the patient has mild acne, moderate to severe, or severe like that. If it's very mild, children are usually very concerned, even small spots on their face. So when they come, we usually do only topical, something to apply. And then we'll tell them about the diet, the habits, and we'll ask, what do you like the most? So they'll tell something. I said to avoid that. So that's going to be very difficult. So because we know you just cannot do any magic. You just cannot stop acne one day. So it will take some time. So basic for very mild skin problems, we always tell them to apply some topical therapy, frequent cleansing, and good moisturizers and things like that. But when we move on to mild to moderate acne, they will have lots of lesions on their face. In olden days, people that will go with days. That is not the point. That should not be like that, because children will end up with scars, and that's you cannot remove scars 100%. So before scar formation, you should treat them. That is the point I always tell all the parents. So when it comes to the moderate variety, you have to start, and there are some mild acne, anti-acne antibiotics like doxycycline, minocycline, limecycline. It can be even for long periods like 2 to 3 weeks, even 1 month, even 3 months without any side effects. Suppose if they're not reacting to that, you are not responding to that, in fact, we will go to the next step. They will add some treatments. There are so many treatments like peels, chemical peels and carbon peels like that for laser. They work very well for acne. So combination, instead of going for the higher antibiotic or something more strong, we just try to keep with this doxycycline or with the chemical peels. 75% patients respond to that. Next is another medicine called, like I told you, isotretinoin, that should be used very carefully in the reproductive age group. But that if you give that for about 6 months to 1 year, it gives very good control. 90% will be gone. Uh, of course, that 10% remains. Maybe they may have one or two pimples during their menstrual cycles. And then we resort to even if those cases not responding to isotretinoin, we move to hormonal therapy. Hormonal therapy, actually, male hormones, testosterone also present in females, but a limited amount. If it goes due to some reason, if the level increases, you may have to give like OCPs and some flutamide, like anti-testosterone agents, flutamides, even spironolactone and things like that. But they should be used cautiously, and we have to take care of points like pregnancy, reproductive age group, and things like that. But very rarely, only 10% go for that kind of treatment. But if you need to use you minimum at least OCPs, we can add in some cases like Femilon and all, we give along with our, if the patient has got a resistant acne. So that will occur only in 10% cases, we resort to hormonal therapy. But that also in 6 months, 1 year time, we need to stop. It will be controlled. The acne will be controlled by then. So suddenly first jumping, it's a last resort. First only giving this hormone, that is not a way. So we have to start from the scratch and
So
then gradually
hormonal therapy is the last one.
last resort.
Okay. Thank you, Preeta. Matching the right systemic treatment to the patient's specific types of acne is what turns a chronic struggle into long-term relief.
Rightly said, ma'am. In fact, matching the skin type, be it applying any cosmetic or, in fact, even on taking any kind of medication, I think, as Dr. Preeta has been constantly saying, just don't Google things and just don't try things that are available over the counter. I think you should go to a trusted adult, speak to them, discuss your skin type, and then go ahead with any kind of medication. Am I right, Dr. Preeta? Okay. Last but not the least, my final question to Dr. Lopamudra. Dr. Lopamudra, as we know, as we have already discussed, we are in the era, on the age of internet. And with internet comes the smartphone, and with smartphone comes multiple apps that are easily available on Play Store. And one very commonly downloaded app is what I have seen in a recent survey has been some AI-driven period tracking apps which helps kids keep a track on when and how they can expect their periods. So, how accurate do you think these tools are when it comes to tracking and understanding the hormonal shifts? And if someone comes to you and asks about using them back at home, would you really recommend that?
So actually, these period tracking apps, how they function, they actually work by studying your previous period patterns by the data which the user has entered. So now we are talking about teenagers. Children in their teenage, they usually have irregular cycles because after the onset of menarche, the initial years of cycles are maximum, they are irregular only. We were like, all the teenagers won't be having a regular cycle. So what's the point of tracking the app then? You won't be able to know when it is coming next. So and majorly teenagers this time, as Dr. Pita said, they are suffering from PCOS and PCOD, and the first symptom which comes, like they complain, is only a regular cycle. So tracking cycle at this age through these apps, I don't think it's advisable. So in like hormonal disturbances and hormonal issues, it is not informative in all these apps. So for any irregularity, any menstrual issues, you should definitely visit the doctor, get evaluated. If you have a PCOD, PCOS syndrome, or any other, like most common cause of irregular cycles is usually hyperthyroidism. Even your thyroid levels, you should get checked. So I would never recommend a child of this age to track her periods in this tracking app. Well, this won't help. Yeah, in the late adulthood, when the woman is in the peak reproductive period, then that might be helpful to track if your cycles are regular. Then only you can have a see when is your ovulation happening, when is your fertile period, and all that, but not rightly at this age.
So I can get it. So, dear kids, if you're listening, the message is very clear from the doctor. I mean, use those apps, keep it like a notebook if helpful, but then leave the diagnosis part to some trusted adult or visit a doctor who can actually give you how to understand your body better so that you get into that natural rhythm. Just like how Dr. Lopamudra just mentioned, that things are very irregular. So, let's give it a little bit of time and let's not jump into technology right away. Okay, thank you, Dr. Lopa, for that wonderful explanation. Now, much awaited. Now that we have interacted with our doctors, I think that was more of a very, what do you say, a very professional kind of an interviewing session for both our doctors. But now I would like to shift on to a fun filled round, which is the flash facts. Two of our students, Adya Madan Kumar and Adya Chenna Reddy, are eagerly looking forward to interacting with our guests through a rapid fire round. Reena ma'am, did you just notice something which is unique? Both our student
Yeah, I
monitors
think
are
it's a
Adya.
coincidence that both our flashbacks
Yes,
they are Adhyas. We have
both
two
of them are
Adhyas, so
Adyas.
yeah, yeah.
So, yeah, over to you, Adya.
Thank you, ma'am. Good evening. My name is Adya Madan Kumar, and my questions are for Dr. Lopamudra. Ma'am, we students love junk food. What is your ultimate junk food pleasure, which after consuming might make you feel a little bit guilty?
I really love cheesecakes, and I actually feel guilty taking after taking that, but I really love them.
That makes sense, ma'am. Cheesecakes sound absolutely delicious. My personal favorite is KFC, but I can see the appeal. How many hours of sleep do you recommend young adults get? And how many hours of sleep did you actually manage to get in the initial years of your medical journey?
Actually, our healthy sleep cycle is at least 7 to 9 hours of good, quiet sleep. But in my current curriculum, I manage getting 4 to 5 hours of sleep. Sometimes sleepless nights also I encounter. But yeah, the average sleep hour is 4 to 5 hours.
I understand, ma'am, it is truly stressful and difficult to manage sleep, but we should try, I guess. Just a little curious. Coffee or energy drinks?
Of course,
What keeps you
coffee.
running?
Oh, sorry, I couldn't wait till you complete.
That's okay, ma'am. I love coffee too. It's great.
Okay, what else you were asking? Coffee or?
Energy drinks.
Okay, my first go to thing is coffee.
That makes sense. It's my personal favorite too. Ma'am, what is one book that acts as a mantra for any aspiring medical professional?
I would recommend the children to read The Alchemist by Paulo Coelho. It's an amazing book. It's about a young shepherd who just goes out, travels across the world in, to find a treasure which he has dreamt of. But then in the long run, he realizes that wisdom, courage, and self discovery are the real treasures of life. So you always have to trust and follow your dreams and never stop believing in your purpose, even if the path is uncertain. Okay.
Thank you, ma'am. That makes sense, and that truly meant a lot. So, I have one more question. What is one question that patients are too embarrassed to ask you, but really shouldn't be?
Anything like any internal problem, like anything related to the vagina or anything related to the breast, they are a bit skeptical. But yeah, they should be coming up and talking about it.
I understand their hesitation, ma'am, but I guess it is important to open up in front of your doctor.
Yeah.
Thank you so much, ma'am. Your answers were truly profound. Now, I would like my fellow peer, Adya Chena Reddy, to take over from here.
Thank you, Atya. My questions are for Dr. Preeta. Mom, if you could swap lives, the cartoon character for a day, who would it be?
Actually, the cartoon character in my days, most familiar one, Tom and Jerry only. So, but I might like to take the position of Tom because he's always determined. He will keep chasing, but the Jerry will keep escaping, but still he has the mental setup, keep chasing. So, you should keep chasing. You chase your dreams. One day you will succeed. So that is the spirit. So I will always want to be Tom, not Jerry, because she's
That's
quite dramatic also, and my behavior, I'm also like that. So I
Very
prefer
truly
being
said,
Tom.
Preeta. You are like that only. Very true.
She
Tom
knows
and
my
Jerry
type.
is really fun. My personal favorite is Motu Patlu. Mom, what is the most unusual thing a patient has applied on their face?
Unusual thing. Actually, I don't have something more like specific to tell, but nowadays everybody put, like, they will always find a remedy which the neighbor auntie will tell you. Maybe some people have put like garlic and all that stuff, and they come with burns. They will come. The most common thing, turmeric and garlic. So they will put on the water as well for any pigmentation, and many times they have come with the burns on that. That is the most common I felt. And normal tomatoes and potatoes and whatever is available, that's quite normal, but that is not an issue. But some things like irritants thing they put. Commonly garlic, turmeric. These are two things which I commonly see in my clinic. And that is
Mom, it's
suggested by
unbelievable.
your relative or your neighbor auntie.
Mom, it's truly unbelievable with such ideas that people can come up to put on their face.
Pardon?
Mom, I said it's like unbelievable that people come
You
up with
also.
such ideas.
Okay. The voice is breaking. That's right.
Okay, Mom. Mom, if your medical degree came with a superpower, what would it be?
Yeah, I wish it should give me some superpower to heal the present kids. Okay, and in my profession, I feel I would love if the medical degree along with it comes a superpower. Like if I do like this, all the acne scars will go and all the wrinkles will disappear. Something like that.
Mom, that would be really easy for your work.
Yeah, it's a good thing, no? Yeah.
Mom, if you could make one rule for a healthy skincare habit that everyone must follow, what would it be?
Water. Drink lots of water. You hydrate your skin. That's the most important thing. And have a lots of colored fruits and vegetables. That is the best thing. I think fruits and vegetables best available in Bangalore. So Bangalore people should always have very good skin. Okay. And lots and water, sufficient water, hydrate your skin. That will moisturize also your skin as well. So it's very good. So I think drink lots of water, more of fruits and veggies, especially those containing vitamin C foods. It's very good for skin from a
Mom,
dermatologist
that's
point of view.
yes, Mom. That's absolutely true. Being hydrated is really important without making it as a rule. Mom, if you have an hour of leisure, what is the one thing that you like to do?
Leisure time. In At this age, I have said sleep. And especially if somebody gives me a coffee, I don't want to make it. If somebody gives me a coffee, it's always welcome. Have a cup of coffee and have a nice sleep. If you'd asked me many years back at 18 years, I would have told like, rainy day, you take a Mills and Boone, read a Mills and Boone, have a packet of chips and lie down like that, something like that. But at this age, I feel I want to rest. And I don't want to go to the kitchen. I just want to, when I get up from sleep, somebody should be ready with the food. That is my instinct.
That's really, everyone loves sleep. That's everyone's favorite thing. Thank you so much, Mom, for playing this fun-filled flash facts round. I hope you thoroughly enjoyed it as much as we did.
Thank you, Adya. Thank you, in fact, both the Adyas for taking our guests through this wonderful rapid fire question round. I'm sure they also must have enjoyed it and must have come back with some of their childhood memories, like how just Dr. Preeta mentioned, ki if I would have been an 18-year-old, my answer would have been different. But now at this age, I would rather prefer something else. Ladies and gentlemen, today we have had this wonderful opportunity to learn from these two exceptional doctors whose knowledge, experience, and compassion continue to transform lives every single day. I'm confident that today's session would have been inspiring, filled with valuable takeaways for all of us of all age groups. I would also like to express my heartfelt gratitude to our management, Dr. Manila Carvalho, our principal, and Vice Principal, Ms. Preeti Suta, for providing us with this platform. We would like to thank the organizing committee, Head of the Department of Biology, Ms. Anjali Kumar, Power Hour in charge, Ms. Sioni Dikshit, and Ms. Richa Srivastav from the English department for the motivation and guidance. We would also extend our gratitude to the Page Turners Committee, Ms. Sumita Chaudhary and Ms. Kadambini Samal. This program would not have been a success without the support of the head of the Computer Science Department, Ms. Vikranti Ashtikar, and her technical support team, Ms. Pallavi Srivastav and Ms. Pooja Ahuja, for the seamless streaming of this live event on YouTube as well as on Zoom. Last but not the least, I extend my thanks to our lovely audience for their enthusiastic support and joining us this Friday evening. Thank you and have a great weekend ahead.